Sir George unfortunately met with an accident yesterday, and he came in with hospital with ankle injury. And is ready to get discharged today. And George is going to tell what exactly, how his experience with the incident and how he came in and how he's going back. George.
Yes, I'm very happy to share, Dr. Reddy. I was getting ready to my apartment to go to an event. As I stepped out of the bathroom, there's a step down. There was a small rug on a marble floor, and when I stepped on the rug, it flew out from under me. I went
Flat
into the atmosphere, and when I landed, I saw how I landed on my ankle, and I could tell from the pain and from the way the ankle looked afterwards that there was a serious injury. I thought it might be broken. My wife and some of our friends thought it might be dislocated. But they immediately called emergency, called the hospital. They sent an ambulance. I was very impressed with the ambulance driver because on the way to the hospital, he stabilized my ankle, which probably helped with the therapy that followed. And when I arrived, they immediately took me into the receiving area, and within a short while, very short while, I was in X-ray. They took an X-ray. From the X-ray, they took me in to meet with some of Dr. Reddy's team, orthopedic surgeons, and they informed me that indeed I had 2 fractures, and that it was going to probably require surgery, but they were waiting on the senior physician's final approval. And I was told that I would require surgery. Within a matter of a few hours, I was in surgery. And the anesthesiologist was an older man, very professional, very comforting and encouraging. And he explained what was going to happen. I'm in the surgery, and he gives me the anesthesia. And within a matter of a few minutes, I was ready for the surgery. The anesthesiologist asked me if I would like to sleep. I said I would, because I was told it was a 3-hour surgery. And I'm still conscious, and my mind is wondering what is going on. I couldn't feel anything. There's no pain. I couldn't even tell what they were doing from the feel of my body. I woke up at the end. The doctor tells me, Dr. Reddy came over and explained to me that the surgery had been very successful. They showed me the post-op X-ray, and where I could see the sterling steel plate that had been inserted into the ankle, into the broken bone, the fractured bone. Yeah. And then they within a short while, thankfully, I had to go to recovery for a few hours, and from recovery I was brought to my room and cared for during the night. I woke up this morning. Another member of the surgery, by the way, the nurses are phenomenal, very professional, but also very easy to talk to and very considerate, and which I was thankful for. And then Dr. Dixit, who's another one of the physicians that's part of
my team,
Dr. Reddy's team, came and showed me the X-ray, explained the procedure, told me it was very successful, and then and told me about the physical therapist who would be coming. Within an hour or so, Mr. Thomas came, a physical therapist who was very, very professional, but very easy to talk to. And he explained the program, his vision, what he was going to be doing. His goal being to help me know how to use a walker and how to become more independent while I'm going through a 6 weeks recovery program. Within another 30 or 40 minutes, Dr. Reddy himself came and smiling and reassured me that the surgery had been successful, showed me again the x-ray, and so I would just like, I have nothing but high praises for Dr. Reddy and his team, for the Apollo Hospital and their technicians and their nursing staff. I made the comment to Dr. Reddy that being from the U.S., my wife and I are from Jacksonville, Florida. The medical community there is very, very, has very high standards.
Yes, yeah.
And our insurance, there's a lot of controversy about our insurance program, but our doctors are amazing. But I told him that I could not have received better treatment from anywhere in the U.S., and that I was very grateful to him and his team and to the hospital for the care that I have received. One of the tests was my blood work to make sure that all the vitals were good, and I passed that. And the other one was a sonogram.
Yes.
So
2D echo for the heart.
So they're listening to my heart. I'm able to hear it, and the technician who was doing that, the doctor, said my heart was very strong. And Dr. Reddy said that I'm in, or Dr. Dixit said that I'm in very good health.
Thank you very much for your kind words. I think this will, I think it's a little, it wasn't a 3 hours operation, it's about 30 minutes, but entire
30
procedure,
minutes.
yes, entire procedure
Okay.
probably took that long. Anesthesia, coming out, recovery. And I think, thank you very much giving opportunity to look after you.
Well, thank you for your very professional and care, and for your kindness.
Thank you very much.